Good morning, one and all. I'm Dr. Shilpa Srewastaw, reader from Department of Oral and Maxillofacial Pathology and Microbiology, MGUMST. Today, our topic of discussion is life cycle of ameloblast. Life cycle of ameloblast is divided into 6 stages. The first one is the morphogenic stage, second is organizing, third one is formative, fourth is maturative, fifth is protective, and the last one is desmolytic. These are the pictures representation, diagram representation of the stages of the ameloblast. First is the morphogenic stage. In this stage, the ameloblast cells are short and columnar with a large oval nucleus. The Golgi apparatus and the centrioles are located in the proximal end of the cell, and the mitochondria are evenly dispersed. During ameloblast differentiation, terminal bar appear. With the migration of mitochondria to the basal region of the cell, the terminal bar represent the points of the close contact between the cells. Second stage is the organizing stage. In this stage, the ameloblast turns from the cuboidal to the columnar one. These stage is characterized by a change in the appearance of the cell. They become longer and the nucleus-free zone at the distal end of the cell become almost as the proximal part containing the nucleus. That is the reverse of the polarity. Due to this, a reversal of the functional polarity of these cells take place by the migration of the centriole and Golgi region from the proximal end of the cell in their distal ends. This reversal of nutrition source is characterized by the proliferation of the capillaries of the dental sac and by the reduction and gradual disappearance of the stellate reticulum, which reduces the distance between the capillary of the dental sac and the inner enamel epithelium. Coming to the formative stage, this is the stage where the enamel formations take place. The ameloblast enter their formative stage after the first layer of the dentine has been formed. During the formation of the enamel matrix, the ameloblast retain approximately the same length and the arrangement. Changes in the organization and the number of the cytoplasmic organelles and inclusions are related to the initiation of the secretion of the enamel matrix. And this stage is also marked as the formation of the Tom's process. Tom's process is nothing but the extension of the ameloblast. The two junctional complexes proximal of the Tom's process is towards this. The two junctional complex is proximal and the distal, which encircles the ameloblast. The proximal is towards the stratum intermedium and the distal is towards the dentine. They have actin containing filaments extending into the cytoplasm of the cell, forming the web at both the end. These junctional complexes align the adjacent ameloblast and play an important role in amelogenesis by tightly holding the ameloblast together and controlling the passage of the substance between the ameloblast and the enamel. Now coming to the next stage, that is the maturative stage. The enamel maturation, full mineralizations, occurs after the most of the thickness of the enamel matrix has been formed in the occlusion and the incisal area. In the cervical part of the crown, the enamel matrix formation is still progressing at this time. During enamel maturation, the ameloblasts are slightly reduced in length and are closely attached to the enamel matrix. The ruffled end of the ameloblast allow the incorporation of the inorganic material, while the smooth end allow the exit of the organic material and the water. Organic material, that is protein. Now the last stage is the protective stage. The amyloblast ceases to be arranged in a well defined layer and can no longer be differentiated from the cells of the stratum intermedium and the outer enamel epithelium. These cell layers then form a stratified epithelium that covers the enamel. This is known as reduced enamel epithelium. So, the reduced enamel epithelium helps in the protection of the enamel. The function of the reduced enamel epithelium is protecting the mature enamel by separating it from the connective tissue until the tooth erupts. Otherwise, enamels may be either resorbed or it can be covered by the layer of the cementum when it comes in the contact with the dental sac. Just before the eruption, when the enamel organ retracts, the cervical portion of the crown, adjacent to the connective tissue cells, comes in the contact with the enamel and deposits a fibril cementum. A fibril cementum is the cementum which doesn't contain the fibers. The last stage of the life cycle of amyloblast is desmolytic stage. In this, the reduced enamel epithelium proliferates and induces atrophy of the connective tissue, separating it from the oral epithelium, so that the fusion of the two epithelium can occur and provide an epithelium lined the pathway for the tooth to erupt into the oral cavity without bleeding. That is why generally there is no bleeding while the eruption of the tooth. The epithelial cells release the enzymes that are able to destroy the connective tissue fibers by the process known as desmolysis. Premature degeneration of the reduced enamel epithelium may prevent the eruption of the tooth. So here we can appreciate the reduced enamel epithelium. So these are the life cycle of the amyloblast. Thank you.